Hey everyone, welcome back to the channel. So today what we're going to go through is we're going to touch on a few exercises to help sciatic nerve pain. For those who have sciatica or pain that refers down their legs, there's one particular muscle that tends to get heavily involved in the process. And for those who have it will probably know this really well, but it's called your piriformis muscle. It's a muscle that attaches from the side of your hip into sort of the middle of your pelvis. And basically what that does is that muscle can tend to get very tight because the sciatic nerve that comes from the lower back can either pass through that muscle or just around it or just underneath it. So if that muscle becomes tight, we can often get this exacerbation of symptoms relating to the nerve as it travels down the back of your leg. So it's really important that if you have this, that you've got one or two really simple exercises to help manage it. But then what we'll get to, as always, at the end of the video is we want to have a quick discussion around why that nerve has become irritated in the first place and go through another really simple exercise to address that. Because what we want to make sure that you're aware of is it's very easy to fall into the trap of just doing symptomatic treatments. You have an area that feels sore, you try and find all the exercises that help that area, but if you're not taking a step back and taking a run at the things that have asked that to be a problem in the first place, then there's a chance that it may keep coming back, or the exercises that you're doing may not be as effective as they could be if you also address the root cause of that problem. So if you hang around to the end of the video, we'll touch on that as well, and then we'll give you a little bit of a bonus piece of information as to why that becomes a problem. So hopefully you have a really logical set of things that you can work on that will hopefully help you manage your pain from sciatica or that sciatic nerve pain as it goes down the leg. So the first exercise is a really simple one. You've probably seen this before. The easiest version of this stretch is to basically lie on your back, on the floor, on a bed, whatever you feel comfortable with. You want to bend one leg up, and if this is the side that has the sciatic nerve pain, you want to try and rotate that leg over the top so that your shin or your foot is touching the opposite leg. Now again, this position on its own may be enough to influence the tightness in that tissue for those who are really tight, but generally we want to approach this in two different ways. The first one is basically trying to pull your knee sort of across and back towards your shoulder a little bit, just to see if you can bias some of the tissue that feels really tight. And what we want to do here is when you get to a position where you feel some muscular tightness, the best way to stretch it, so the best way to stretch this is not just holding it, despite what we see a lot, despite what you might hear a lot, for example. The best way to stretch it is to activate it. So you want to put it in a position that you do feel the stretch, but then you want to push back into that stretch. So by pushing back into my hand, by pushing my knee back into my hand, I'm able to activate the muscle I'm trying to stretch. That gets your brain and nervous system involved. You're putting it on sort of maximum tension, then tensing it up is followed by a sort of max relaxation. So what you should feel is when you find a position that feels tight, so this feels a little bit tight for me, then when you push back into your hand or squeeze this muscle, it should work for about 5 to 10 seconds. And then when you relax, you should feel like you can go actually a little bit further than before. And this contract, relax stretching or PNF stretching is one of the fastest acting ways to change muscular tightness. It should happen instantaneously. So if you're not walking away from this particular version of the stretch feeling better, then you may not have been doing it correctly. So what we can do from that, so the next part of this is we can grab a hold of the opposite leg. So you can wrap a towel around if you want to. But what we're trying to do here is we're trying to increase that hip flexion. So by holding the opposite side, if you pull that towards you, however you feel comfortable, again, you might need to move from side to side to find the best access to your tightness. So we're sort of combining the first and second stretches here. But for me, that feels like it's a really good stretch deep in that hip joint. And again, all we want to do here is push that shin back into the knee, make those muscles work. Do what you need to do to engage that piriformis, that tightness. Hold it for 5 to 10 seconds, and then as soon as you relax, again, you should feel like it's just gone a little bit further, or there's a little bit more room to move before you run into the end of that range. Now, as I said, it's a great exercise to do because you should feel that there's some immediate changes so long as you've done that contract, relax. Now, if that position is too hard for you, or if it's too easy for some people, we want to try and ramp it up a little bit further. So for me, what I find the best is we want to make sure that we're doing what's called a pigeon pose. And we've gone through this before on the channel, but essentially you can do this on the floor if you're a little bit more advanced. If you find it trickier, you can do this and use your surface as a bench or a chair, just so you're not trying to drop down into as much flexion here, but you're sort of almost doing it up on top of something and then leaning over. So how this looks is we still want to have that external rotation of the hip. If you can get your knee down, it's a bonus. But the point we want to make here is that if you sort of take your bottom back as you lean over the top, you don't have to drop down here, because a lot of the time when you try and drop down onto your elbows, you're not necessarily bending the hip more, you're just hinging through the back more to get down here. If that works for you, that's fine. You can find a really powerful stretch by keeping your back straight, pushing your hip back a little bit as you bend forwards. And again, you should be able to find some genuinely good tightness in the side of that hip or the back of that hip. And again, the most important thing with this stretch is you want to push back against it. So you want to push your shin into the ground, squeeze those glutes for 5 to 10 seconds, make the muscle work. Again, once you've relaxed, you should feel like it's a little bit looser and you've got a little bit more room to move when you do that. So again, you can do that one on a seat, on a tabletop, on a bench. You just want to find a position that you feel most comfortable in, that gives you access to that tightness. So that can be on your back, that can be on a chair. It doesn't matter how you do it, as long as you feel like it's done something afterwards. And for me, it feels like there's a lot more sort of range of motion in that hip. So if you've got some sciatic nerve irritation, it's going down that leg, that'll help take some of those symptoms out of the equation. So, excuse me, as we mentioned off the top, just freeing up that muscle on its own can be a fantastic way to help you manage, your sciatic nerve pain if there's pain down the leg, but it doesn't address the cause of that muscle tightness. Now, piriformis muscular tightness that's involved with the sciatic nerve, it only does so because the nerve's asking it for help a lot of the time. So if the part of your spine where the nerve's coming from has become dysfunctional for whatever reason, it could be because of a disc bulge, it could be some stenosis where that joint or that joint space narrows and irritates the nerve a little bit. It can be just some general neural tightness that's come from joint stiffness or muscular tightness in that lower back. There can be a range of different reasons why that sciatic nerve has become problematic, but we still need to address the central tenet of that problem. Otherwise, that piriformis stretch is something you're going to have to keep doing without end, unless something magically changes that you're not aware of. So, and again, as we've gone through before, one of the best ways to specifically find and then manage any of that stiffness or tight dysfunction that might be in the lower back is with a ball. It's very specific, it's very safe. So the type of ball that you use really depends on how your back and how your symptoms feel. If you haven't done it before and you feel like your back's quite sensitive or things are quite irritated at the moment, obviously go for something a lot softer like a tennis ball. But if you're just doing this for some general mobility work or trying to free up that nerve in general, a harder ball is great for those types of situations, or if you feel like your pain's not too bad. So for the purposes of this, we'll get rid of the tennis ball, we'll go straight for the lacrosse ball. But what we want to do is we want to place this in your lower back. We want to go looking for joints that feel stiff, tight, or tender. We want to try and find those areas and we want to keep the ball on there, keep some constant pressure on those joints so that you feel like it starts to release that sort of central dysfunction. So how that looks, which we'll get to in a second, is we want to be able to find the bones at the back, I guess the bony surface that you can feel in the middle. And when we're down low, we want to start in the middle and let the ball roll off to the side that you're having a problem with. So for the purposes of this, let's pretend it's this side. So we're going to start in the middle and just roll a little bit off to the side so we're onto the actual joints at the back. And what we want to look for is we want to look for some tightness and stiffness, get a sense of how well the ball sinks into that side, and then compare it to the exact same spot on the other side. Because what we find with spinal dysfunction is that even if you put some pressure on one side and it gives you all of your symptoms and you say, right, well, that's the cause of all my pain. If it's not the stiffest side, if the other side is stiffer, then to treat the other side is more important because the other side is where the stiffness is coming from. So that could actually be the step before why that side's become a problem, because your body doesn't care about left and rights. Everything's connected. So if I pull some slack from this side of my shirt, it affects the other side. There's no imaginary division here that stops everything from happening. It can pull slack from the other side. So if the hinge of dysfunction or the area of dysfunction is here, for example, technically anywhere around that, anything associated with that can become a problem. So it's a really important point. Look for stiffness and tightness more than tenderness. Respect where it hurts. If it's stiff, tight, and tender all on the same side, fair enough. but just be aware that it could be on the other side, particularly with the neural connection, the neural involvement. Probably 50% of the time, the dysfunction's on the other side, and the nerves sort of, it's a chain reaction of events that leads to that. So what we want to do, we're going to place the ball in the sort of the middle of your back, down the bottom where the bony bit is, and just let it roll off to one side. And all we want to do here is gently lie on your back and let the ball press in. So again, you can do this standing up or sitting up against a wall. You do whichever position you feel most comfortable in. And I prefer to have your knees bent up. If you do straighten your legs out, sometimes that sort of arches the back a little bit. It takes a bit of the pressure off the ball. So when your knees are bent up, your hips and knees are bent up, you can sort of keep your back a little bit flatter. It just assists the effectiveness of the exercise. So again, world's simplest exercise. Again, be respectful in case it is tender. So all we're doing is we're moving it around, just up and down until you feel like you hit a spot that feels involved. So for me, I found a nice, comfortable spot that's a little bit tender. So then if I roll back across to the other side, then I don't feel anything on that side. It doesn't even feel tight. It doesn't feel tender. So for me, I need to be working on this side if I want to release that anchor, basically. So again, don't get sucked into rolling up and down despite using a ball. The joints in your back are very specific. If you can see that, very specific, very small. So you want to make sure that you're systematically working your way up and down, just exploring where that stiffness is. So once I've spent a minute or two here and I'm satisfied that something's given, I'll just move the ball up just a tiny little bit more, go looking for the next spot. So again, that feels a little bit stiff and tight for me. So I'm going to hang out here, let the ball press in and do the work for me. So it's a really, really effective way at trying to sort of get to the central root cause of that sciatic nerve that's become a problem, and not just stretching the piriformis and hoping that that cures all of your symptoms. It'll hopefully help those symptoms regress, but we want to regress those symptoms and treat the cause so those symptoms don't come back again. So that's the second exercise that I find really useful for sciatica. It's just a great way to get to the root cause of that. And then again, as we said before, there's one final bonus piece of information that we always need to sort of tack on the back of any conversation about back pain and treating back pain, is that your back doesn't become a problem by accident. It can often feel that way, where one moment you feel great, you might move in an awkward position and then something happens, or you might just get out of bed one day, or it might just eventually become sore. For most people who don't have that horribly traumatic accident that gives them their lower back pain, the root cause of their back pain often comes back to the positions and the postures that you put it into. So when you're exploring the health and function of your back with the ball, if you're finding that as you come up or as you come down, if you're more on one side or the other that feels stiffer, there has to be a reason why that's the case. There has to be a reason why one level is stiffer than the other, why one side is stiffer than the other. It's not bad luck. It's not that you're right or left-handed. It generally comes back to the most common positions or essential theme that you put your back into day to day. And I guess the classic case for a lot of people is sitting. Sitting is the most common long-term cause of back pain. The next one's something like leaning over, things like that, where you're, instead of keeping your back in a nice position, without realizing it, we start to default into a position that's less than perfect, and we're stuck there for hours and hours and hours a day, over weeks, over months, over years, without ever really noticing that we're beginning to stiffen and tighten areas of the back, still doing all the things that we want to do activity-wise, but we're doing that with our handbrake on. So the point of this, I guess, last piece of bonus information is to say that if you find that this particular part of your back is stiffer than the areas above and below, it's very likely that that's the part of your back that you might be hinging through without realizing it. So if you do a job that you have to bend over a lot, it's very likely that that's where you're bending through. If you're just sitting down watching TV or driving somewhere or using the computer, again, it's very likely that you're hinging through that part of your back and staying there over time. So again, if we're trying to free up that piriformis to help your sciatic nerve pain, we're trying to free up the spine to unglue the nerve so that tightness doesn't come back again. We also need to improve the position that your back's in, either by rolling up a towel and just shoving it in between your back and the surface so that you can't sink into that position. It just holds you in a good position. If you want to get through those symptoms and make sure they never come back again, the really boring stuff at the end about posture and positioning matters. It's something that you need to be aware of. If you're not aware of the positions you put your back in throughout the day, then it's very, very hard to keep yourself, I guess, back pain free, sciatic nerve pain free, and sciatica free at the end of the day. So hopefully those sort of 3 pieces of information can really help you track how it's happened, but also get you through that sort of sciatic nerve pain with some basic exercises and some stretches. So as always, if you did go on to like the video, if you feel like it was useful, we'd really appreciate it if you could leave a like below. It really helps support the video, helps the video get out to more people, and this information is good information. It's what we talk about with our patients, and we get really good results with that. So we'd love for more people to see that. And if you're new to the channel and you enjoy what we're putting out, again, please consider subscribing as well. It just helps us via the YouTube algorithm. So that's what we have today. If you have any questions, please leave them in the comments below. I'll get back to you as soon as possible. But until next time, we'll see you soon. Bye.